Thank you for the honor to come up and speak to you guys. And when she gave me this title, I was like, oh my gosh, this is what I do every day. My background is that I have been a nurse for 42 years, as long as we've been married. I've been an acute care nurse practitioner for about, 15 going on 16 years. My practice has basically, I think I have to laugh where God leads you, right? So I started at UK Med Center. I dealt on a floor that was pretty acute. I dealt with a lot of heavy diagnoses because in Kentucky, UK was the foundation for the hospital that needed people needed the most help. They came there. I went on, became into ICU. I traveled up to Northern Kentucky. I went into ICU. Then from there, I went into more ICU, and then I went into open heart surgery. Then I got burned out, stepped out, started a home care agency with the Health Alliance at Cincinnati at that time. Got to see a lot. I had so many hats in that. Got to deal with even terminal illness. I was pronouncing people at home from hospice. I was dealing with a lot of heavy diagnoses at home. Then I became a manager in acute care, in an agency. And then I came back into the cardiothoracic surgery world. So my perspective for heavy diagnosis is in the inpatient world from the clinical perspective. So a lot of what I'm saying is, it made me stop and think about what do I do, or how do I help people, or what do I see people in the actual clinical setting. And hopefully it'll go on to home to help with the diagnoses. So be patient with me as I go through this. I have to think about personal experience into what I've written.
Great stuff.
Oh, well, thank you. So I call it critical illness. Now, heavy diagnosis, I'm taking it from the perspective, oh, thank you.
You've got to speak it.
I got to speak up, okay.
Yeah.
My husband would say opposite, but no, it's just teasing. So we think of terminal illnesses, we think of heavy diagnoses. The definition, I think, is acute and critical illness because, as you can see, serious and critical and complex illnesses often eventually lead to fatalness, right? We know you get that heavy diagnosis, it leads to that your life has now bounds, right? We have this inward ability to preserve ourselves, to fight, to flight. And when you are given that diagnosis, you're like, wow, how much longer do I have? So I think the term terminal illness means it encompasses much more. Serious, critical, and complex conditions are seriously disabling and will worsen until death. We know that. Virtually all conditions require more complex organizing services over time. There is a different set of individuals for those who are serious and complex who have the diseases, but they are not likely to die. They have to re-enter society. So that, again, that's why it needs to be redefined. The focus is that they're running businesses, they're initiating relationships, they're continuing relationships. They're going to live for some time. And if prognosis is actually ambiguous, patients may well chaffed under the expectations and restrictions that society has come to label terminal illness. So I think that needs to be put aside. We need to look at it as just a heavy diagnosis, critical, acute illnesses. What is the emotional effect, and I'm going to use the term critical illness because that's where I work. What is the emotional effects? It's a serious health problem that really disrupts all aspects of your life. Whether it's a chronic or life-threatening illness such as cancer, major health event such as stroke, heart attack, or debilitating injury. Now in our world, in the setting I work again in the cardiothoracic vascular ICU. We have people on ECMO. We have people who just like this, a win-win. We had a lady come in and deliver twins. She went into eclampsia. She went into ARDS. She had to be put on external, we call it ECMO. We had to put her on the heart-lung bypass machine in order to save her, okay? So she was on that for 2 weeks, or a week and a half. But the win-win is that she was able to come off of it. I got to see her hold her twins out, introduce them. But that is debilitating illness. That's a critical illness. Her life was on the thread. Again, I have people with LVADs, with a heart-lung, they come out with a heart pump. mechanical heart pump that they have for the rest of their life. That's a critical illness. There's many different ways to diagnose that. You have people who have lung cancers and everything. Whatever it is, it's upsetting your life out of the blue, whatever it is. And again, when I talk about this, it's for those who have it and for the caregivers that are taking care of people like that. You may feel overwhelmed by waves of difficult emotions, from fear and worry to profound sadness, despair, and grief, or just numb, frozen by the shock of the feeling you'll be never able to cope with this. I mean, in my world, unfortunately, there's times I've had to tell people these diagnoses, and having them just look at me like, you have got to be kidding me. Do you know what I mean? It is totally devastating. The emotional upheaval can make it difficult to function or think straight, or even lead to mood disorders such as anxiety and depression, which is just an understatement of how it makes people feel. We all hear of the Kubler-Ross. We all know that, the 5 stages. Where's my nursing student? Yeah. Nod your head, yes. But there is something called the 7 stages of grief for chronic disease. Again, they use the term chronic, but I want to use critical. And it's this. You have denial, you have plea bargaining, anger, anxiety, and depression. Loss of self, which is huge, loss of self. Confusion, you go on to reevaluation of life and acceptance. It doesn't mean you go through those stages. You may have 3 or 4 going on at one time. You may have it all. Do you know what I mean? You just don't know. And I think this really, I like these 7 stages better than what I was educated in. Common emotional responses to serious illness: anger, frustration, like why me? What did I do? Why am I having this happen to me? Facing your own mortality, prospect that the illness could be potentially life-ending, and it will be, probably. Worrying about the future. How am I going to cope? What's going to happen to my wife, my husband, or how am I going to live without them? Whatever it might be. Grieving the loss of your health in your old life. Your life is going to change. You're going to have a new perspective on what your new life is going to be like. Feeling a powerlessness, hopeless, or unable to look beyond the worst case scenario. Regret or guilt about things you've done that you may have contributed to your illness. Oh my gosh, I didn't do this, I didn't change, this is why this is going on with me. Could be that you were doing things that would affect your health. Denial that anything is wrong. I've had people be really angry with me. That is wrong. Your tests are wrong. I want a second opinion. Please help me. A sense of isolation, feeling cut off from friends and loved ones. A loss of self. I don't know how many times people say, I've lost me. I am just this lung cancer. When you go in, and especially, I hate to say this, in the medical profession, there is a lot of physicians that will diagnose, this is stage 4 lung cancer, this is what we need to do, this is our protocols. No, this is Larry Brown. He is having lung cancer, this is how we need to work with him. Facing a serious diagnosis, some things to think about how you can face this. Allow yourself to feel. How many times have we been structured in society, this is our pathway. Allow time for you to feel how it's hitting you. Get to know your illness or condition. I can't stress enough to patients. Know what is affecting you. Know it. Don't run away from it. You're going to have to deal with it no matter what. Be patient with the pace of treatment and recovery. Oh my gosh, people just want it like, I'm ready to do this now. What kind of surgery do I need? How do I get better? How do I speed this up? There's no fast way. There is a slow boat to China. Do you know what I'm saying? And unfortunately, you and I are on it together here. Reach out for support. We are not an island. That means caregivers. That means patients. You with the diagnosis is be patient with yourself and reach out for support. Go beyond that. Social support has a huge impact on your mental health. Friends and community, look for those who are good listeners, not the ones that just nod, okay? I grew up in the society where you had a dog in the rear view dash, that if you stopped, the dog would just nod, you know what I mean? We have, that's not what you need. You need someone that's listening and gives you input and feedback, but you're going to have to find those people. And don't be embarrassed that if it's like not your closest family or your closest friends or whatever it might be. Explore your emotions. Learn to face them. Takes courage. It takes bravery to be able to do that. You know, because a lot of times we want to categorize it. We want to lock it under the door. You are going to have to say, okay, I am feeling this way. When your feelings are freed, you will find these emotions will get up and go quickly when they come back again. You've identified them, you dealt with them, it's onward now. Manage stress. Okay, that's an understatement, right? I mean, we can't hardly manage stress in our everyday life, right? But it can help you relieve the anxiety, alleviate the fatigue that just keeps like sucking you in, that you can't sleep. It helps boost your mood. Anything you can do to help decrease the stress. It could be therapy, activities, whatever it is. You know that this is all going to be, if you don't do it, it's going to be detrimental to you. Deal with the anxiety and depression. It can become a vicious cycle. It is a hamster on a hamster wheel. We had a hamster with our son, Fufu. That was his name. That hamster would just clock miles every night. I would just hear it, you know. That was its thing. But it's the same thing with emotions. If we don't stop the wheel and get off, it just continues to dig us deeper. Illness triggers anxiety or depression, which can erode overall health, which turn negativity expands. It impacts the treatment of your illness that worsens and your mood disorder. Distinguish between solvable and unsolvable worries. The what if syndrome. I mean, we all have been guilty of that. What if this happens? And I have patients ask me all the time, what if this goes on? What if this? I'm like, and then I have this one saying I just love. It says, there's 2 days of the week you cannot control. Do you know what they are? And they all look at me like, what? Yesterday and tomorrow. and they're like, oh, you're not funny. I'm like, that's okay. Again, though, verbalizing, saying your what if out loud. If you actually say the what ifs out loud, and if I could get a patient to tell me the what ifs, I can help them see how big it looks really, and it's not. So that's really important. Okay, facing more things to help face a serious diagnosis. Communication strategies. You have to learn to master open and honest communication. You have to find that safe person or that safe therapist or whatever it is. You have to be able to be communicative. It's pivotal for maintaining a strong connection with people. Emotional resilience. Building up resilience helps us to adapt and thrive despite the adversities of chronic illness or acute illness, critical illness. Resilience. I don't think we talk about resilience enough. I appreciate what you said about that. Resilience is something that is not a trait we're born with. None of us have that tendency toward resilience. It's something we have to learn to build in ourselves. It's taking on those negativities, looking at the outcomes and knowing that there's something beyond that. It is like getting back on the bandwagon. I'm going to do it. I can see the outcomes. I know this. And as you do that daily, it's a daily decision to do that, you build your resilience. Team mentality. It doesn't have to be one person to carry the person to the end. Okay, I do marathons. I used to run them, and now I just speed walk, and that's fine. But I never forget the biggest mentality that helped me the most was that I had one marathon I was struggling running, and I was just struggling the last 3 or 4 miles. You know, that's when you're asking, why in the world you're here? You know, you're like, daggone, I shouldn't be here. There's a picture of it crossing the finish line, and I have 6 of my running friends around me, and they'd already finished. They went back out and got me and brought me in. Team mentality helps you to overcome the obstacles and share the victories. That is huge. Now, the biggest thing is the urge to lean into vulnerability. Again, I go into that. It aids in maintaining relationship, especially with health. It also plays a critical role in improving relationship bonds amidst the challenges. Open communication serves as a bridge, connecting you with your support person in profound ways, ensuring together you are fortified to face whatever comes. And I think that's the biggest thing we need, is that we need that person to hold our arms up. We need that person to say, hey, you're going to make it today. This is your shield. We're going to work on this. Recognize that both you might transverse these stages of different paces. You're going to have one person that's this far along, could be the person caring for you. You can see it, I know we're going to get to this, and the person who has it may be back this far. You're going to have to realize there's going to be a gap and be patient and compassionate with each other. You may have to take on that person to help them over that hump. Or the person who's ill may be further ahead than the person caregiving for them. You may have to be able to learn that and to know this is where you're at. This understanding, again, fosters emotional support and resilience. I love that word. Finding moments of joy. That is huge. These moments serve as a beacon of light, illuminating the path through what can often feel like an unending struggle. Don't be scared to look for joy. Don't be thinking, oh, I can't be happy now. I've got to focus on this. That is not how God made us. He wants us to find the joy and the peace in that. And we have to look for it. It's something we have to focus on doing. It's not for mere distraction. It's a foundation block, again, for building emotional resilience. It's an intentional thing you have to do. You have to find the joy in it. It might be celebrating small victories, like, here, like less pain one day, or hey, we didn't, I made it through this day without having to lay down. You know what I mean? I was able to get through this thing. Confronting the trials brought about by a chronic or critical illness can magnify emotional turbulence. And I thought this was an interesting thing. I learned things as I did this, and I learn things every day. But pattern interrupts are essentially sudden shifts in behavior or thought that can prevent emotional escalations. So if you have a pattern interrupt, say maybe you're going down a spiral and you stop it, it acts as a circuit breaker. And whatever you can do, maybe between your support team or you taking care of the patient or the family member, you can say, hey, wait a minute, this is a circuit breaker, we need to stop this. And you work that out ahead of time. It improves the communications, it strengthens the bond, and it helps you from spiraling downward. And I like that term, pattern interruptions. Again, it is crucial to remember that support exists beyond the confines of your known relationships. Family and friends often wish to help, but they just don't know how. They're just getting through it themselves. I don't know how many times I've walked in and we may have had a patient for a couple of weeks and we got to send them out. They're just not even beginning to how to take care of him to be able to support him. Take the initiative, and maybe if you are the one with the diagnosis, it may be you taking the initiative to say, hey, I need to go outside the block here. I need to go outside my comfort zone and see what's out there to help me. Professional help, as I have all my colleagues with the social work division, really help a lot in therapy. Do you know what I mean? Therapy is essential for a lot of this. And I think we have to be humble enough to say, I need it. You know what I mean? I am not strong enough to be able to handle all this. I need it to help my family. Do you know what I mean? It may be a way to pull your family in to help with all that, or friends. There are many therapists who specialize in critical illness. I have seen one, especially after getting through COVID and all the acute patients I had then, and she's helped me to process the acute cases I had. But they understand. They can take the grief process and tie it to the critical conditions and help to recalibrate the relationships to get through this new normal. That's it, the new normal. We don't use that term. This is your old life, but this is the new normal. Seeking help from support groups is huge. As we do it in everyday life. If you're, like I'm a runner, I have my running group, right? If you're a mom, you have your mom's group, the kids are going crazy. Whatever it might be, that brings you comfort realizing that you're not alone. And sharing experiences with others helps others, and it makes it incredibly grounding for yourself. 10 affirmations. I thought this was interesting. I sort of pieced this together, but I thought this, someone had this on the internet, and I thought it was good. Together with God and my support team, I can face whatever comes my way. You get up there and you say that. My love for God and others grows stronger with every challenge that together is overcome. And if you really think that and say it, your mind changes, that you process it. I am grateful for the love and support that is given to me in what I share daily, right? You have to think about, okay, it may not seem enough, but you've got to realize what you're getting and say, I am grateful. Every day is an opportunity to strengthen my bond with God and others. I communicate with honesty, love, and compassion daily. I cherish the moments of joy and laughter daily. I, with God and my support team, are facing the ups and downs side by side. The relationship I have with God and my others is a source of some strength and comfort. And my journey is unique, and I will navigate it with grace and love. And love, resilience, and understanding are part of the foundation. So, going through all of that, I think it helped me to put into words what we normally do every day. Okay, every day when I see patients or we go through diagnoses. I know before camp, I had a 4-day stretch. I had 3 deaths before I could even get to camp. The kids are my bomb. But it was the process of knowing that I was there to help patients, help their families. Do you know what I mean? So I think not to deflect or not to demean what we can do, or the diagnosis that we have, what we can bring ourselves up to with God's strength, which I do use with my patients. I do talk to them about, what is your belief? What do you do? How do you work this out? And they're pretty open to me about it, and which I appreciate that. But it helps that we can help each other more so as we're getting older, or we're getting more sicker patients, whatever the case may be, that I think it is a journey of our life. Thank you. I do have some bibliography, and I just put it out there. I couldn't go into the critical end of this because it was really dry. I wouldn't want to read it myself. So I tried to find you articles that would be more uplifting. And that's it.